Imagine waking up one day and realizing that something feels off, your body isn't changing the way it should. Maybe puberty hasn't come, or sexual development has slowed, or even stopped altogether. It feels like the switch that's supposed to turn on your body's natural changes is just stuck. And that's when it hits, you're not alone. Millions of people experience this delay or disruption, and it has a name: hypogonadism. Defining hypogonadism, the basics. So, what is hypogonadism? Hypogonadism is a medical term used when the body doesn't produce enough sex hormones. Think of sex hormones as the secret sauce behind so much of what makes you, you. They're responsible for puberty, body hair, sexual development, and even things like your mood, bone strength, and fertility. When the body isn't making enough of these hormones, it's like trying to run a car on an empty tank. When we talk about sex hormones, we're talking about estrogen for those assigned female at birth, a FAB, and testosterone for those assigned male at birth, MF. These hormones come from glands called gonads, ovaries in FAB individuals and testes in MF individuals. When these gonads don't work as they should, we call this gonadal deficiency, or more simply, hypogonadism. The two types of hypogonadism. Hypogonadism comes in two flavors, primary and secondary. Let's dive into each. Primary hypogonadism. In primary hypogonadism, the issue lies within the ovaries or testes themselves. They aren't able to produce the hormones your body needs. Even though your brain sends signals, shouting at the ovaries or testes to start making hormones, these organs just can't respond. Doctors call this hypergonadotropic hypogonadism because the body produces high levels of hormones meant to stimulate the gonads, but they're just not listening. Secondary hypogonadism. With secondary hypogonadism, the story is a little different. This time, the gonads themselves are fine, but the problem occurs in the brain, in the hypothalamus or pituitary gland. These glands are like the command center, directing the ovaries or testes to produce hormones. But when they're not working correctly, the signals don't get sent, and the gonads never get the memo. This is called hypogonadotropic hypogonadism. What causes hypogonadism? Hypogonadism can either be something you're born with, congenital, or something that happens later in life, acquired. Primary hypogonadism can be triggered by things like genetic conditions, infections, injuries, or even exposure to chemotherapy. Secondary hypogonadism can be caused by tumors, hormone deficiencies, head injuries, or other medical conditions that affect the brain. Spotting hypogonadism. What are the signs? One of the tricky things about hypogonadism is that it can look different from person to person. It may not even be obvious until you reach puberty or later, especially if the symptoms develop gradually. In teenagers, it might show up as delayed or halted sexual development. If you're a FAB, this can mean your periods don't start, or there's little to no breast development. In MF, you might notice minimal facial hair, a lack of deepening in the voice, or less muscle mass. As an adult, symptoms can include things like low sex drive, trouble with muscle growth, fatigue, brittle bones, or even depression. In severe cases, hypogonadism can lead to infertility. Getting a diagnosis. Getting to the bottom of a hypogonadism diagnosis isn't always easy, but it usually starts with a physical exam. Your doctor will look for signs that your body is developing the way it should for your age. They might check things like muscle mass, body hair, or sexual organs. Then come the blood tests. These tests are crucial. They'll measure your hormone levels, looking specifically at estrogen if you're a FAB, or testosterone if you're MF. They'll also check for other hormones, like LH, luteinizing hormone, and FSH, follicle-stimulating hormone, which stimulate the gonads. A lack of these might point to secondary hypogonadism. In some cases, imaging tests are necessary. If there's a suspicion of a pituitary tumor, for instance, an MRI or CT scan can help to locate it. Treatment options. Managing hypogonadism. Once diagnosed, the treatment plan often revolves around addressing the root cause or using hormone replacement therapy, HRT. If there's an underlying issue like a tumor, surgery might be needed to remove it. Hormone replacement therapy, or HRT, is a common route for those whose bodies simply aren't making enough hormones. For OFAB individuals, this means estrogen replacement therapy, while for AMAB individuals, testosterone replacement therapy is the way to go. HRT can be administered in several forms, including injections, oral pills, patches, gels, and even tablets you can dissolve in your mouth. But that's not all. In some cases, doctors might also recommend injections of FSH or HCG to help stimulate fertility. What does living with hypogonadism mean? Living with hypogonadism can be challenging, but it's manageable with the right treatment. It often requires long-term care and regular check-ups to monitor hormone levels and adjust treatments as necessary. But with a consistent treatment plan, most people with hypogonadism can lead fulfilling, active lives. Remember, if you're experiencing symptoms that could be related to hypogonadism, don't hesitate to reach out to a healthcare provider. Taking charge of your health is the first step towards a better, healthier you. Hypogonadism may seem like a big word, but with knowledge and the right support, it doesn't have to be a big obstacle. Your body's development isn't just about growing up, it's about feeling like your true self. If you or someone you know is struggling with symptoms of hypogonadism, know that help is available. Whether it's through hormone therapy or treating an underlying condition, medical science has powerful tools to help. So don't just sit and wonder, seek answers. Because the sooner you understand what's going on, the sooner you can take control of your body and your health.